Welcome back to our channel. Today, we're tackling an important question that many coffee lovers with high blood pressure might have. Can I drink coffee if I have high blood pressure? Whether you're a coffee aficionado or just enjoy a daily cup, this is a topic that has stirred up a lot of debate. If you've been worried about how your favorite brew might be affecting your blood pressure, you're not alone. The connection between coffee and hypertension has been studied extensively. While some suggest that coffee can cause a temporary rise in blood pressure, other research points out that moderate consumption doesn't significantly affect hypertension for most people. So, is it safe to drink coffee with high blood pressure? In this video, we'll dive into the science and break down the key facts, backed by research and expert opinions. By the end, you'll be able to decide what's best for your health. And as always, be sure to consult with your healthcare provider. First, let's quickly understand what high blood pressure or hypertension actually is. Blood pressure is the force of blood against your artery walls as your heart pumps. It's measured using two numbers, systolic and diastolic. If your readings are consistently higher than 130/80, this is classified as high blood pressure. Untreated high blood pressure can lead to serious complications like heart disease, stroke, and kidney problems. That's why it's so important to manage it with a combination of lifestyle changes, medication, and regular monitoring. Now, what does caffeine, the main stimulant in coffee, do to blood pressure? Caffeine can cause a temporary spike because it stimulates the release of adrenaline and may constrict your blood vessels. But here's the twist. Some studies suggest that people who drink coffee regularly might not experience long-term increases in their blood pressure. For example, research from the National Institutes of Health suggests that consuming 1 to 3 cups of coffee per day may actually reduce the risk of developing high blood pressure. However, the effects vary depending on factors like your genetics, age, and overall health. In fact, one large study published in the National Library of Medicine found that people who drank 4 or more cups of coffee per day showed a potential protective effect against hypertension, particularly in women. Other compounds in coffee, such as chlorogenic acid, may also contribute to its overall effect on blood pressure. But it's important to remember that individual responses to coffee can vary. What works for one person may not work for another. So what are the key factors to consider when thinking about coffee and blood pressure? Your baseline blood pressure is crucial. People with existing hypertension may respond differently to caffeine than those with normal readings. Timing also matters. Drinking coffee earlier in the day might reduce its impact on your sleep and blood pressure. Interestingly, research suggests that regular coffee drinkers may develop a tolerance to caffeine's effects over time, meaning that the short-term spikes in blood pressure could lessen. However, it's always a good idea to monitor your own response and consult with a healthcare provider. Interactions and alternatives. It's important to note that coffee and caffeine can interact with certain medications and even some foods. This interaction could impact your blood pressure or make your medication less effective. That's why it's always best to consult your healthcare provider before making any changes to your coffee habits, especially if you're on blood pressure medication. And for those looking to enjoy coffee without caffeine's potential impact, decaf is a great alternative. Decaffeinated coffee has much less caffeine, making it a better option for individuals with high blood pressure who still want to enjoy the taste of coffee. But remember, even decaf can contain trace amounts of caffeine, so it's still important to monitor your body's response. Coffee alternatives beyond decaf. If you're looking for caffeine-free alternatives, chicory root coffee or mushroom coffee blends can offer a coffee-like flavor without caffeine. These options can be great if you're sensitive to even small amounts of caffeine or simply want to avoid it entirely. Coffee quality and acidity. High-quality, low-acid coffee like General Warfield's specialty-grade coffee can also make a big difference. Specialty-grade coffees are often less acidic and gentler on the stomach, which may also help keep your blood pressure stable. Our beans are responsibly sourced and roasted to perfection, making them a great option for those who want to enjoy coffee without compromising their health. Since stress can also raise blood pressure, It's important to consider the environment in which you're drinking coffee. If you tend to drink coffee in stressful situations, it may amplify its effects. Instead, try making coffee part of a calm, relaxing ritual, whether it's enjoying your morning cup in peace or taking a mindful break during the day. A few quick tips for coffee lovers with high blood pressure. For those of you who want to keep enjoying coffee while managing high blood pressure, here are some helpful tips. First, stick to moderation. That means no more than 3 cups per day. Pay attention to how your body reacts and try drinking your coffee earlier in the day. You might also consider brewing methods that reduce certain compounds, like using a paper filter to reduce caffeine, which can raise cholesterol and blood pressure. Finally, remember that coffee is just one part of a bigger picture. Managing high blood pressure often involves lifestyle changes like exercise, hydration, and a healthy diet. Sleep and coffee timing. One more thing to keep in mind. Consuming coffee too late in the day can interfere with your sleep, which can negatively affect blood pressure. If possible, enjoy your coffee earlier in the day to avoid disrupting your sleep cycle. Final thoughts. Can you drink coffee with high blood pressure? For many, the answer is yes, in moderation and with careful monitoring through communication between you and your doctor. The key is understanding how your body responds, and most importantly, always checking in with your healthcare provider before making any changes, including coffee consumption. Ready to enjoy a delicious, low-acid cup of specialty-grade coffee? Try General Warfield's delicious and responsibly sourced coffee. Visit us at generalwarfieldscoffee.com. And don't forget to like, share, and subscribe for more videos like this one.